Okay, good afternoon, everybody. Thanks for taking time out of a busy Friday to join us for what is now our 21st Digital Dispatches. We're delighted to have Yvonne Connolly from the Leadership Centre with us today to talk about the learning management system. She has brought some of her colleagues along with us. She'll introduce those. As usual, put your questions in the chat and we'll get round to them as soon as the team have finished their presentation. So this has been recorded and it will be available on YouTube for those who can't attend today. So please feel free to share with your colleagues. And I'll hand over to Yvonne and look forward to hearing about the new learning management system.
Oh, thanks very much, Linda. Vicky's just gonna, oh, Vicky, you're ahead of me. You've got the slides up already. So we're delighted to be here today. And as Linda said, I'm Yvonne. I am the Senior Project Manager for the Interim Regional Learning Management System project. I'm currently working in and I'm based in the Leadership Centre. Joining me today as part of this presentation, I have Keith Bailey. Keith is the Interim Principal Consultant Digital within the Leadership Centre. Keith is also the manager of the current e-learning regional platform. And once we go live with the new platform, Keith will also manage the contract for the new LMS. So in addition to Keith, we also have Vicky Thompson. Vicky is based and works in the HR Directorate within BSO. And Vicky is one of our LMS implementation leads. We also have trust colleagues, Justin Stevens, and Justin is the LMS implementation lead within the Southeastern Trust. And Justin's also based in their HR Directorate in the OWT team. And last but not least, we have Kevin Kennedy, and Kevin, again, one of the implementation leads, but this time in Belfast. And again, Kevin is also based in their HR Directorate. Okay, so we were asked to come along today and just really give you some information about the project. So what we hope to do today is give you a bit of an overview of the project, a little bit of insight into who we are, what we're trying to do, why we're doing it, and when we intend to do it. I suppose a first look or an overview of the new LMS, and our new LMS, its actual name will be Learn HSC NI, and we'll give you a bit of a glimpse in terms of the functionality, the features of the LMS, and the many benefits that it has as well. We'd like to give you sort of a preliminary understanding also of what HSC NI will mean for you as staff, both line managers, training providers, admins, etc. And as Linda said, there will be an opportunity to ask any questions that you have. So just feel free to pop those into the chat. So as I said, just a little bit about who we are. So this project, it is a regional project. It does have a fairly large footprint in that this system is intended for use by all of HSC staff and also some associated non-HSC staff. Our project sponsors are the regional HR directors, and our SRO is Jackie Kennedy. Jackie Kennedy is HR and OD Director for the Belfast Trust. So the core team for the project, myself, Keith Bailey, and Lauren Camlin, our project support, we're all based in the HSC Leadership Centre, and we have 7 LMS implementation leads supporting this core team, and they're based in the trusts and BSO. We also have representation on our project board and within our implementation team from regional training providers such as the HSC Leadership Centre and the Clinical Education Centre, and also Encompass colleagues. So just to give you an idea about when we're kind of rolling out the LMS and what has happened to date. So we actually kicked off the implementation phase of this project back in November, early November 2022. We have 6 key work streams, and they are all really well progressed, and we are moving at pace. I'm particularly moving at pace because we have a very ambitious timeline, and our plan is to deploy the LMS to staff and make it available in this first phase in early April. Our focus in this initial phase is to provide access to core statutory and mandatory training for all staff, and also to provide our Encompass colleagues with a platform that they can actually upload all of their Encompass training as well, and start to roll that out and make it available for registration. So why actually are we, did we decide to implement a new LMS? First and foremost, it really was about statutory and mandatory training. We are really keen to give our staff access to all of the core statutory and mandatory training they need to do their job safely, and in doing so also to improve our compliance levels with statutory and mandatory training across HSC. We also want to provide for the staff a really, really good user experience. Currently, staff have to log into multiple platforms to access various bits of training. We want to provide this all in one platform. So in addition to accessing your training, completing your training, this is also going to make it easier just to have everything in the one place recorded. But we're also conscious that, like, probably in the last 5 to 10 years, how people actually consume knowledge and how they consume learning has changed. You know, very much those Google moments, you know, wanting to access learning immediately. And I think during COVID, we all really had exposure to how we could do things differently in terms of learning. So we are keen to support those modern approaches to learning in the form of this platform. And last but not least, the LMS project also is a dependency for the Encompass programme from a training perspective. We are providing this platform to enable our Encompass colleagues to roll out the high volumes of training that they need to deliver to support the rollout of the Encompass system. Okay, so I'm going to pass over to my colleague, Keith. And Keith is going to tell you a little bit more about the new platform.
Good afternoon, everyone. Yes, I'm Keith Bailey, digital lead at the Leadership Centre, and my digital team currently looks after the regional e-learning platform, hsclearning.com. So any of your current statutory mandatory training is probably done on that platform. And that's part of a disparate ecosystem of learning, and one of the drivers for unifying your learning into one area. So we have HSC Learning. If you book in for a management course, you have the Leadership Centre website. If you book in for a CC course, there's another website for that. If you're part of the Belfast Trust, you have an internal learning system as well, and our medical and dental colleagues also have another system there. So if you're a Belfast nurse, I think I counted up potentially 3-4 logins you would need depending on what course you're trying to access. So one of the major drivers of this project is to unify and get a single login that's based on your email address, and will work through the HSC Uni network. We're also trying to improve your mobile access. So while HSC Learning can be accessed outside of the HSC network, some of the courses don't work on it, so forth. So we're trying to give remote access or improve remote access for your learning, so it can be done more on the fly, or if you're on trains or buses and you want to duck in and complete part of a course, you'll be able to do so. We have struggled in the past with limited resources. So for a wee while, there's only been a few people managing the systems around, and knowledge, as people move around the system and change jobs, that knowledge moves with them. So being able to support these systems and the thousands of emails that the Leadership Centre get over a year regarding transfers and changing jobs and password requests, we're looking to be able to federate that a lot more out to the local organizations. So there'll be a greater support level that comes with the new system. With all the current learning systems, HRPTS as well, there's cost and duplication. So there's 3 Moodle systems in play in the HSCNI at the moment. So being able to pull that and cover that off and learn HSCNI is obviously a saving to the service. Integration with HRPTS, downloads, real-time reporting, getting reports to be reflective of when they were produced and not a 30-day-old view of things, of compliance, is a critical part of moving forward, as is passporting. So if you've ever had the luxury of shifting from one HSC organization to another, while you see your training record move on hsclearning.com, the new organization currently doesn't see that you're compliant in cyber awareness, cybersecurity awareness. So there's this process of transfer of proving that you're valid and trying to avoid you having to duplicate your learning. And this particularly affects the likes of trainee doctors or placements who move around a lot. So we're trying to prevent the duplication of learning just so you can be reported on. The user experience, the last point there, so that's how it looks and feels to you. So Moodle, the current system, it's functional, it's not pretty, it has its drawbacks. The new system is best of breed and looks and contemporary, has been branded for HSCNI, as you'll see in a couple of screenshots. Last year, we went through a procurement, and Civica were the successful supplier. They run a platform called Agylia, and it's best of breed. It allows for smooth searching an entire catalog. It allows for targeting of courses. So if you have ever logged into HSC Learning, you are presented in your available courses with every course that can possibly be done. So what happens in Agylia is we're able to target. So if you're admin and clerical based role, you will no longer see the likes of future nurse or future midwife as an option to learn. You will only see what is relevant to your role and your organization. The system itself, Learn HSCNI, sorry, we can go on there, Vicky. There's a wee screenshot there of the branding at the top there. So it's going to be very much tile-based. You will click on your calendar like you would on Outlook to see any in-person events. You're able to access quickly courses you must do. So statutory, corporate, statutory and mandatory courses will be already applied to you. You will not have to enroll in them. You will be able to still self-enroll in other courses relevant to your organization, and you'll have direct access to CEC, Leadership Centre and NIMDA courses via dedicated channels. The platform itself will enable a wide range of trainings from e-learning to classroom, virtual and blended. There's a whole number of tasks you can do. You'll be able to book into sessions. You'll be able to select a date, time that will suit you if there's a multiple session course. The platform itself can be accessed from your web browser, particularly from a work device, but there is also going to be a dedicated mobile app. And this is going to be quite critical because if you've ever experienced some of the learning platforms, even HSC Learning there, if you have a network outage, if your Wi-Fi drops for a little bit and you're halfway through a course, the way it works is you think you've completed it, but the message doesn't come through. So that creates user frustration, queries, whereas this mobile app, you'll be able to complete learning offline. If you've accessed the course, you'll be able to do it offline. As soon as your device comes onto a network, it will then transmit your completion, your progress to the system, and that will bring the database up to speed. So that's going to be a great feature of being able to complete your training offline. With that, I'd like to pass over to our implementation lead for BSO, Vicky Thompson, to take you through a little bit more about the system and what it means for you as users.
Brilliant. don't even need to introduce myself. Thanks, Keith. No, definitely in terms of like, this is Learn HSCNI, and this is built around terms of users. So it's been very much configured with users in mind, and it's ultimately there to enhance the learning experience for our colleagues across HSC, and obviously those non-HSC users also. For users on the system, it's going to allow you to easily find, navigate and access the range of training that you need, but also really save you time. So as Keith was saying there, it's very onerous when you go onto the current system to try and find the courses that you need. This will be very much targeted towards you. So you have your My Learning there with anything that's mandatory and your own personal learning, and then also in terms of your organisational catalogue, so anything that's applicable within your organisation. So these sections are tailored to each user. So it's really kind of making it that kind of seamless journey in terms of being able to find them and also to complete. So it's obviously having that catalogue there in terms of the array of things that are going to be available to you. So yeah, that's really much in terms of focused around in terms of the users, like the main things are going to be very easily accessed, in terms of finding that kind of intuitive navigation piece that we have built into this new system. So very much keen to get even using it as a self in terms of my own use. But if we're looking at it a wee bit more closely, there's a big new modern look and feel, and I'm pretty sure you can all agree whenever you look at that initially in terms of this, what every user is going to be presented with the exact same landing page. So they'll all be directed here, and based on our current system, you can definitely see in terms of the colour, the engagement, the branding, our values, and all of our images and stuff that we've used throughout the system. It is very easily navigated through, very much in terms of the tabular format, like Keith was saying. It's very structured to the user. It's engaging. It makes you want to go and discover kind of what's behind each tile. At the top here in terms of your banner, it'll be hi, it'll welcome you. So it'll say hi, Vicky. So it's really that personalised approach as well that this system's going to bring. And obviously take on those onerous kind of limitations that our current systems we have. So obviously the key focus is making, as I was saying, they're really easily accessed, specifically around as well your statutory mandatory training and your personal professional development programs. It's all in one platform, it's all in one place. As Keith was going through there, you don't have to go to the Leadership Centre website or the CEC or like NIMDA. It'll all be accessed here. So saving on those clicks daily. So if we're looking at in terms of the training that's delivered by them, the Leadership Centre keeps sending some of the management courses, kind of those, but that will all be in that separate catalogue. And then anything that's obviously delivered internally will be found in your organisation's catalogue. But ultimately, what we're going to see here is a really greater user experience, across the desktop, tablet, mobile devices, which is tailored to you, the user. Having this one system, as Keith is going through in terms of some of our limitations, the duplication of work. So you only have the one login for the one platform. And it's going to allow you obviously to book all in terms of those face-to-face trainings, your virtual sessions, access any pre-recorded things. Whenever we've seen the system kind of a wee bit in action, we've had the sneak peek. It's more about in terms of like even the imagination as working within learn development of what we can actually utilize this system for as a user as well. In the current system, whenever my mandatory training goes out of date, I sometimes forget about it. You get that single kind of email to remind yourself, but this will also send you reminders that it's due for completion. You'll obviously get any up-to-date notifications regarding any changes in your training. So say if you've enrolled onto a program and it's been cancelled or it's been changed to an alternative location, you will get those notifications to your email address. So it's allowing that in terms of real-time changes, and it's really allowing that kind of seamless journey for users. But the best thing I do think in terms of for a user perspective is that you will have your own learning profile. And as a user, you'll have more visual, you'll have more control of your learning, and it really allows you that kind of clean, clear, concise overview, and it's personalised to yourself. So in terms of you're looking through, there's a wee bit of a snippet of what it could look like. So you'll have your mandatory training, you've got your learning calendar, you've kind of got a wee bit of a history all written down there. So it really allows you to show you in terms of what's coming up, what you have done, your statutory mandatory training compliance, your out of if things are coming for renewal. And obviously any training that you actually complete or attend via Learn HSCNI will be recorded on your profile. So there's no need in terms of to update it. The only thing though you will be able to do is to update it after. So say if you, for example, go for a course outside of Learn HSCNI, then you'll be able to update that onto your own profile. So it's really allowing you to bring everything kind of into one, and it's allowing you to kind of gauge that comprehensive learning profile for yourself. Agylia as well, if you move obviously between your trusts or organisations, this training profile can move with you. So obviously any of those regional courses that you do undertake, as long as you remain in date, you'll not have to repeat those, because quite a lot of times that's what we have current frustrations with our system. So definitely in terms of a user's perspective, it's going to be so much more engaging, so much nicer looking, very modern, up to date, and really kind of put the control within the learner as well. I've kind of taken you through in terms of what it's going to look like for a learner, and I'm going to pass over to Justin, who's going to take you through the next couple of slides.
Well, here we go. And I've just forgotten to mute myself or unmute myself. Thanks very much, Vicky. Yeah, the whole learner dashboard thing is continued on in terms of what the manager can see. So this is sort of extended onto what we're referring to as an intuitive manager's dashboard, which will give all staff with management responsibilities greater control and clarity over the learning status and journey that their staff members are going through. Okay, this replicates pretty much what is going on in the learner profile, but it's with slightly more access to different details, and it will allow you to see a number of different things. Okay, so this includes the ability to easily find and assign training to your individual team members, and all of this will apply on, as Keith and Vicky have already said, on the same system. So it's all like a one-stop shop for everything. You will not need to maintain local training records, because everything that's been completed by your team members should be available to you on the system itself, which will make life an awful lot easier for any of you, like myself, who have had to try and look back over training records to track your team's compliance, to see when expiry dates are coming up, when they next have to attend training, or more to the point, who's booked in for training when you're actually trying to figure out who's going to be in work those days. Okay. You can easily monitor statutory and mandatory compliance across your team. Now, I would put one caveat in saying that you have to make sure that all of your team members are against you, the correct manager, so that you can track that. But that's something that we'll be following up on as part and parcel of the project itself. And the final thing, the final part of this, which has long been lacking in HRPTS, is email notification. Okay, so as a manager, anytime a member of your staff books themselves on a course, you will be notified that that person has been booked on. You will be asked, if relevant, to give your approval for that. Now, an awful lot of our training we will make automatic to save on the burden on managers from actually having to answer endless emails for people booking onto courses. But really, where it's important, where your approval really matters, then you will be asked for it, so that you can make sure that your people are going to the right place at the right time with the appropriate permission. Okay. Vicky, can I have the next one then? Thank you. The other side of the user experience then is those with more specialist access to the system, and that includes anybody who is providing training within the trust and anybody who is administering training within any of the HSC organizations. Okay. All I can say is, from my own personal experience with the LSO functionality of HRPTS, this is a dream come true. Okay. Because the lack of an intuitive interface for the management of training has long been a bugbear of training providers like ourselves. And this thing just makes administrating training an absolute dream. Okay, it's a doddle. Now, I'm sort of putting an awful lot of our credibility on the line here by claiming these things, but given our experience so far, and more to the point, our comparison with what we've been used to, this really does provide us with an awful lot more functionality and an awful lot more intuitive ease of use, which hopefully will be reflected on how quickly we can get people up to speed in and skilled in using it. What you see in front of you is actually one probable reflection of how good it is in terms of simply marking attendance at a course. So the bit on the left-hand side of this is your actual attendance list, even though it's slightly blurred out to save the innocent. All you need to do as a training provider is move the little button from left to right to mark people as attendant. Now, we've already had some conversations about how we're going to do this, and you could do it traditionally by taking a sign-in sheet to your course and then returning the sign-in sheet to your admin people and handing the sign-in sheet to your admin people and getting them to go onto the system and filling out the attendance record. Or you could just have your phone handy, as Keith has already said, and as people are coming in the door, you could just nice and simply mark them as attending or turning up. And that is your administration done for that particular course. The simplicity of it and the beauty of it, the elegance of it really, is something that I think we're all looking forward to trying to get really hands-on with and seeing if we can make the absolute most of it. The other side of things is that we can also upload a wide range of learning content. And I mean, this varies from Keith's e-learning, digital learning side of things to individual documents like PDFs or presentations. Multimedia can be hosted as well in terms of videos and also links to external sources in various web pages. Okay. In addition to that, we can actually and actively or proactively target training to specific groups of staff. So at a wide level, we could say all band 5s need to do this training. At the widest level for mandatory training, we say everybody in the HSC needs to do this. But you can actually narrow that focus, that targeting down to small individual groups if it's really necessary. So identifying a very specific cohort of specialists that need a very specific course, to just using the existing groups of staff that we have here at band level, at personnel area level, at departmental area level, or whatever. Again, the limits of this or the constraints on this are really something that we have to test out fully, but the potential offered by it is really exciting. Scheduling of training is fairly straightforward. As Keith also mentioned, you can have multiple timetable sessions for one particular course to give people that flexibility to book onto it when it is more convenient. Digital learning, of course, is accessible on a as you need it kind of basis, but scheduled training will always appear as a timetable. It can be covered and will appear on that calendar element of that's on your initial platform or launch page. And what the scheduling functionality will also do is send reminders and communicate with attendees or applicants, sending out joining instructions and additional documentation or supporting materials, whatever is required to get people where they need to be at the right time on the right day. Okay. As people complete training, it's recorded and will be automatically added to the learning record. That means that as soon as you tick any one of these little attended boxes, it's on your record and it is there for us to either as a user have a look at it on an individual basis, or as an administrator or a manager to look at from a more collective basis, so that we can actually start looking at the numbers and tracking things like compliance and even training needs assessment if need be. Okay. This is the facilitator-led dashboard, and again, it's another reflection of the dashboard functionality that kind of summarizes all the essential information into one place in a nicely intuitive and legible and understandable format, rather than having to dig down into reams and reams of tables and Excel spreadsheet information. Now, behind this, there's an awful lot of detailed information which will be part and parcel of the reporting functionality. But on a very simple and day-to-day level, this enables us as administrators, facilitators, and trainers to track, analyze, and report on learning activities everywhere across the organization. It will be, for each individual administrator or instructor, it is specific to what you do. So you won't necessarily be bombarded with other people's training. So there is a sort of filter process and action there, depending on who owns what in terms of the training up on the system. But it does allow you to show how learning programs are impacting performance outcomes and can be linked quite easily to business objectives. That's me done. I'm going to hand on. Oh, sorry, this is my last one. I'm getting ahead of myself, Kevin. I was almost about to pass over to you. We wanted to show you this one mainly because we get kind of, I don't know, we're all sort of learning nerds where this thing is concerned. So this part of it is one of these features that we always want to share with something. And these are called curricula, or learning pathways is probably a better way of describing it. But what it actually allows us to do is combine different elements of training. So you could have a digital learning course, one of Kate's e-learning courses, then you could go on a face-to-face follow-up session. You can have different tasks in here, like reading policy documents, all forming part of this pathway. As you can see, the blocks go down from top to bottom on the left-hand side of the slide here. And what it does is it allows you to bring things together into one bundle that a person doesn't have to, and the learner doesn't have to go looking for it all the time. It means that they're always there available, where linked training is kept in one place for people to access with ease and facility. Okay. It means that all of this can be marked and tracked really easily. All of these elements could be conditional, so that you might have to access part 2 of the training, you might actually have to complete part 1, but we can also leave it open and flexible. But there is that potential about making certain things dependent on preceding steps, which is a feature that we're looking forward to getting to grips with as well. And I think that covers pretty much what I need to say. I'm going to hand over to Kevin, who's my colleague in the Belfast Trust.
Thank you, Justin. Yes, so that is Justin Stephen, folks, who has promised great things. So whenever everything goes belly up, speak to Justin, ignore me. Only joking you. Look, it's my job just to wrap up. I'm keeping an eye on the questions coming in here, and there is good questions. If you do have any questions, keep populating them, or we'll get around to you all towards the end of this. It'll help us also develop some sort of FAQs on the back of today. So look, what we've basically covered today is where the LMS has got to. We are on target to launch in spring of this year, 2023. It will be phased, so our most important thing is getting all statutory and mandatory training across and onto the system so it's accessible to staff. From then, and I sort of have to be careful what way I word this, the HRPT LMS function and HRPTS, our regional e-learning platform, or within Belfast, our e-learning platform, that will all sort of be stewed down. It'll not go anywhere, so like you'll not lose all your historical training records that currently sit on the HRPTS. They will be there, that next year, the year after, if you need to go back and see something really far back, you can do that, so it's not being deleted completely. But the Learn HSCNI will replace all those different platforms that Kate's touched on, so it's just one login for the people to access. Our training, so what we're going to do is develop, we have already planned cascading a training across the HSC for all L&D administrator or L&D license holders. That will include functionality like how to use the system, for training providers, for reporting, for admin staff who maybe upload records currently. What we're going to do is use it almost like a train-the-trainer model on that. We're going to train up people within Trust to start off with, and hopefully cascade that down. But because we are such a tight-knit community on our regroup, we're going to lend support to each other across, say BSO, for example, may not have a range of staff who could deliver it. Belfast will jump in and give them a hand. And everybody will get training up. And that, I would probably imagine that it's going to be really the rollout that's going to be throughout March and April as well. So there'll be plenty of opportunities for you to get onto it. The regional communications, so you are all excited because you all read the communications that are being shared out across the teams this week in the trust this week. They will continue to develop. The more we know, the more we will let you know. And we will get into like every fortnight or so in the build up to this to say, you know, here's what the next stage of it is, here's how it looks. And the FAQs will also develop on that. And then the phase 2 is post go live. So as I said at the start, our priority at the minute is statutory monitoring training and all the technical aspects that come with that. Post go live, then we're going into phase 2, which is widening the use of the platform to support a wider range of trust delivered content. So that is our personal development programs, our non-mandatory courses, CPD courses that people may want to do to complete as well. So that's basically a summary of where we've got to today. Hopefully you'll agree that the system does look really well. It is a lot better than what we currently have. It will be easier for our service users. It will be easier for our staff to get access to, and it'll also take a lot of manual tasks away from our learning and development people at the minute. So in summary, the key takeaways are that the platform can be accessed anytime, anywhere. It doesn't have to be on a trust device. Okay, it doesn't have to be on a trust device. It can be done on your mobile phone. Kate's already touched on there'll be apps available for it too. Notifications through the apps and stuff are available. If you're on your way into work, or maybe with your staff at the statutory Monday training, you might say, look, you need to get that completed. You can finish a half hour earlier so that I can complete that whenever you get home tonight. And that just allows for greater flexibility whenever it comes to a new and modern way that we deliver training across the HSC. So it's modern, it's engaging, it's not too clunky. It is very intuitive to use. And most of all, because it is not as many clicks on it. So Vicky touched on that, saying you don't have to click from one system to find something in another system. It's all in there. It's blended. You can do wee bits now and come back to it later on. The system will track your progress. So you might complete 50% of a course, and it reminds you like you're halfway through, even if you get a chance to go back in and do it. And then it'll help our user capability as well across all roles, learners, managers. I'm not behind the door whenever I say the constant bugbear is HRPTS for the LMS function isn't great. So we are going to fix that problem. This LMS, from what I see, it's great. It's enjoyable. It's engaging. It's exciting. We're getting into the sort of part of the program now whereby we just can't wait for it to go live and get users using it and make their experience a lot easier. Okay, so look, there's key contacts up. I think the slides will be shared up, but you will be able to contact your leads within each organization if you have any specific questions in relation to the LMS itself. We will share the contacts over with you as well before the end of this. I think now what we'll do is head over to some questions, if that's okay. Yeah. So look, I'm going to do the MC. And I will not answer any of the questions, but divvy them out just so I can't get shouted at for getting the wrong answer. So one of the questions was what if staff have multiple posts? Which manager will see the training? Keith, I'm going to come to you on that one, if that's all right.
Keith, I'm just wondering, you might have missed that bit, but I'll let you go ahead there, and if you want, I can step in for that bit.
Mm-hmm. Well, look, why did you come in and you answer
so
that?
First and foremost, looking at folk with multiple posts is definitely something we've looked at. We've done a lot of number crunching. We have purchased 100,000 licenses for this system. We do want to move away from that, where you have multiple posts, that you have more than one user account. So it'll be your actual primary post, and it's whatever way that is determined within your trust, because the system can only support one approver within the LMS. But it is something that we're working with the supplier to see, is there a way that we can toggle between posts? But look, to be honest, at the minute, after doing the number crunching, the folk that actually have pure multiple posts right across HSC is a relatively small number. So it's a wee bit further down our priority list. For us, the importance is getting everybody onto the system with at least one primary account. So Jane, I think that was your question.
Just a follow-up on that. If as well, say if a person has a substantive post and moves to bank only, will the qualifications transfer over?
Well, yeah, if they have a substantive post, we're also going to support our bank staff, and we're going to also give them a post as well. Now, the actual, I don't want to get into too much technical detail here, but everybody will have one post, and your username will be your actual trust email address. So that's what will take you to the post, and the training will be assigned in that way. So yeah, as we're going to provision the accounts. So if that changes and that information is coming through from the HRPTS, that will change your position number, your role, etc. And then whoever your line manager or primary approver is would change as well.
Perfect, thank you.
Okay, Jane has a second question here. Could you target newly qualified nurses? Justin, you touched on the ability to target staff in there, so do you want to come in on that one?
Yes. Sorry, that's the answer to both questions. Yes, I'll come in, and yes, that's the answer to the question.
Yeah.
Yes, you can target newly qualified nurses.
Brilliant. So Mark says, if someone is marked as did not attend, are they automatically put on a waiting list? Keith, I think I'll hand over to you on that one. I think I know the answer to it, but you can clarify.
Keith, you're
that one I'm not sure about. I've been away for that. I'll do the next one on the list, Kevin. But
yep. So look, to stick on that one just for Mark. Yeah, if someone is marked as they did not attend, are they automatically put on the waiting list? I've been playing about with it this week to try and figure something like that out. If someone goes in as cannot attend, so before they actually attend the course, they remove themselves, they're given an option to re-enroll. If there is other dates available on that, they can quickly go in and do that. If someone does not attend, no, they're not automatically put back on the waiting list. The person will have to go in and reassign themselves on the course for that. So if you know that you're not able to attend the day before, so long as you cancel, it should be there. But it's probably something we probably bring back to Civica to see if there's even a functionality within that to see.
Yeah, Kevin, I think it's worth adding to that at each course that you actually upload to the system as a content administrator, there are various rules that you can apply to that course, such as, when it's cancelled, when it's actually shown, when you hide it, and you can have rules around the approvals, and actually around waiting lists and stuff, there are different rules as well, but we haven't quite got into the detail of all of that. But as I said, lots of different combinations that you can avail of as the content administrator. Yeah.
Okay, Keith, you've read the next one. So Jane, for CPD, will certificates be issued?
Yes is the answer, and they're going to look a lot better than the current ones. So hopefully people are seeing an example there on screen of a template. There will be certificates, and there will be certificates of completion.
Great. Let me see, where are my questions going now? So who do we have after that? Yeah, Craig says, will records of training completed to date be transferred from HRPTS onto the new LMS? So yeah, technical, Yvonne, I'll go back to you on that one.
Yes, so we haven't progressed very far in terms of the actual learning history migration. We have been focusing on moving our content across, but we are starting to look at that on Monday. What we plan to do is identify, for example, all the core statutory mandatory training. And for example, if your fire safety is within the period, health and safety and other training, we can transfer that across. And there are different ways that we can do that. We can either kind of make it as a live course or as a certification. The caveat with that is, depending on where your record is currently held, we just need to ensure that we have a unique identifier to match the training that you've completed with your identifier in the new system.
Brilliant. Okay, Brenda has says, no link on homepage for social workers and social care workers. Without nurses, midwives, AHPs, Meta, Dental do have their own link on the homepage. Brenda, I will come into that. There is no link on the homepage for role-specific training. They are the organizations. So the one that you see on there is CEC. That is a training organization. HSE Leadership Centre is a training organization, as is NIMDA. I've been calling them NIMDA, but I've got it wrong. Apparently it's NIMDA. Yeah, so it's actually the training organisation, but the ability to target specific TNC groups. So if you want to target work to just social care workers or social workers themselves, you can do that, but we didn't show it today. It's in the back end. So that will training, if I say we're doing our adult safeguarding level 3, all social care workers had to do that. It would be assigned to that role specific, and it would sit in behind my learning for their role. Hopefully that answers that. Can agency staff access this? Yes, they will be able to access it, but it's not one of our key ones at the minute. Again, one of the big things we're trying to get on at the minute is all our staff in post, but it's part of phase 2 whereby they will roll out and do it.
Yeah, Kevin, I think, and the answer is yes, we do plan to give access to agency staff. Just slightly sitting behind that is because this system, we will be setting up the user accounts. We're not letting people self-register, because often what happens is duplicate accounts are created, or the incorrect information is provided to us, which then limits our ability to target, etc. And also in terms of our reporting. So really in the background, within the organizations, we just need to identify single source of truth where we have a full data set for agency, and then we can upload those and create those accounts. So what we are aware of, for example, is NIAS would routinely pop their agency staff on HRPTS. In that case, NIAS will be ready to give out accounts to their agency staff. So it's kind of like a different picture across the different organisations. But again, definitely on our to-do list.
And Jane has the next question, and that is, can student nurses and midwives use this? It's much the same picture of what you just explained.
Yeah.
Okay. So Brenda has a question: support for L&D staff to make shift from traditional learning to be able to create curricula. Vicky, I'm going to come to you on that one. About the training for them.
Yeah. So obviously, as Kevin, you had said it anyway, we're going to be doing like that regional kind of training plan, and part of that will be targeting different specialist areas. So if people are creating those kind of curriculums or being responsible for that, there will be training provided for those roles. And definitely I think in terms of what I picked up in the system so far is when we start to use it and kind of see the functionalities of what it can do, we can see what other people are doing and how we can kind of approach that within certain areas. So there's so much scope available, but again, that is a wee bit further down the line. That's the hello to phase 2. We're very much just focused on the statutory and mandatory at the minute, but there will be that whole regional training plan pushed out across all levels.
Brilliant, Vicky. Ian has a question. Does it alert staff/managers when mandatory training is due? Justin?
I can take that one. Yes. Yes,
it
does.
Yeah.
No, and I mean, and feeds back to what Yvonne was saying in terms of configuration of courses. You can configure each of the courses with reminders, almost scheduled reminders as and when you need them. So yes, it can send out a preset reminder that your expiry date is coming up a month before, 2 weeks before. It can even send a series of reminders if you prefer to give people the odd nudge over a more extended period. So it is very configurable in terms of the way it can do that. Yeah,
and Justin, those reminders can be configured from, really pleasant through to now get it done. Yeah, listen, I suppose the caveat with the notifications and the reminders is that we do need an email address to send those to. So the fact that we're using email address as the username is really important as well, because the guys in the various HR teams are now off doing a bit of an exercise in terms of validating which email addresses they have and haven't got, and so validating that against their Active Directory.
So Martin has a question here that Martin may need you to just explain a wee bit more on it, or it might need to be just taken offline. On the agency, would access be available to NHS staff outside of NI that were required to undertake mandatory training, specific focus on Encompass that may have locums, nurses, etc.? Yvonne, you could probably come in on that.
Yeah, we are working really closely with our Encompass colleagues, and as you're probably all aware, our Encompass are doing a really comprehensive exercise in terms of analysing which staff will need training for the Encompass system. We are able within the system, well, I'm saying that out loud now and I'm hoping that it works, but we have tested it and it appears to work. We will be able to specifically target that training to the folk that need it. So yes, if we have been asked to create an account for those folk, theoretically we can do that. I guess this is more about the permissions and what we're asked to do, etc. Yeah, so probably haven't got down to the exact detail, but I know that locums, etc. have been mentioned, but maybe not from the perspective of that they're outside Northern Ireland.
Yeah, specifically on that, if there is, people who are aligned to an agency that sort of live outside the border region. So if there's someone, a nurse in Donegal that, they work for HSE, but they don't necessarily work for the HSCNI, it's the requirement to have a HSCNI email, which they wouldn't have.
I imagine there would be some sponsoring organisation. There would have to be agency under an HSC organisation, and that's the route that they would receive an account. Because it's email based, I don't feel it'll be an issue that it would be an HSE email or something like that, but there would have to be an agency connection to a sponsoring HSC organisation.
Yeah, I did notice, sorry, Kevin, I'm going to jump ahead because there is a question here somewhere with what if you don't have a HSC email address? So in terms of our staff, we have set it up that if you don't have a HSC email address, the system will use your staff number instead as your username, your unique identifier.
Yeah, I think you probably cover a couple of weak questions there, because anyone who's asked around about multiple roles and stuff like that, that's probably the same. There's a question here, not a question, more just a comment that banks/nursing HCA staff may have worked for more than one trust. And we know that we have talked about that on the group. Again, we're looking at ways in which the system can identify those people so that they don't have multiple posts, they only have one.
Yeah, and Kevin, the thing is that it may be if you work across multiple posts or multiple trusts, there's an argument for and against it. Often if you do have separate posts, the statutory mandatory training requirements for both of those posts will differ as well. And also both of the trusts, because although we're all using the one system, there are kind of like borders within this in terms of information governance, etc. Both trusts will want to be reporting on statutory mandatory compliance for those that fall within their staff profile. So hence there may be a limited amount of folk that do have more than one account, necessitated by where they work.
Okay, folks, look, I'm just conscious we only have just over 5 minutes left on this. If anyone does have a question that they really think needs answered now, if you can throw up your hand, but we will come back to you. We'll carry on doing the questions now. But if you have something there that you really need to know before 1 o'clock, because someone's life depends on it, then you can let us know. But we will come back to them all in some sort of FAQ. Yvonne's touched on how can staff who do not have trust email address log in. You don't have a trust email address, there still is a functionality for you to be able to log in. It just reduces the ability to receive emails and stuff like that onto it. And ideally, we want all staff to have an email address in the best case, just for cyber security and everything else goes with it.
Kevin, I see there's a question about reports. Absolutely, you can create reports. There's a whole set of out-of-the-box reports. There's so many of them. We're kind of still trying to get our head and work through them, what you can do. But yes, you can put in particular parameters for a particular trust. So completely all staff and work in a particular organisation, e.g. BSO, PALS, etc. So Vicky, that's probably something in particular you've been looking at as the BSO rep.
Yeah, so I've been engaging with PALS colleagues in terms of trying to identify those who would want those specialist roles to be able to report on. So I know obviously you just have your local training register, which you luckily know would no longer need to apply because it'll all be able to get from the system. So definitely there'll be something we're working with PALS colleagues, so we can definitely explore this in terms of to meet your needs of what you may need in the report.
Okay, there's just two on managers here. One was, do managers receive an email if a participant does not attend, and can managers book staff on the training?
I can take that, Kevin.
Yeah.
Yes and yes. Okay, that's my final word on those. Yeah, again, it all depends on the way you configure the communication. So We're still exploring the full range of all the notifications available, but I'm pretty sure that a DNA letter to manager and back to admins are available as part and parcel of the system. Again, you can choose to have it set up as part of the configuration of each individual course or not. And can managers book staff onto training? Yes, via the manager's dashboard, you can just click on your member of staff and then apply that training to that member of staff just by going in and searching for it. We've got an awful lot of staff I know in my own trust who don't necessarily have access to a system and might be reluctant to use their own devices to do it, to book themselves on. So managers can still continue to do so in the same way that they do on HRPTS to a certain extent.
Yeah. Keith, I'm going to come to you on this one. It's around about the next 3 are sort of together. So they hit the CEC is commissioned to provide post-registration education nurses, midwives, and AHPs. Brenda's come in to say social services commission deliver, or social service commissioned SWs and SCWs, post-reg students. And then the last one was around about, this may have already been answered, but will training be specific to each trust? And I think that they are just 3 targeting questions. They're all the same. So
yeah, I've got a feeling Heather might be discussing with Brenda or defining what the CEC actually deliver regionally, and Brenda is confirming what social services. So I don't see those as 2 questions. But Maria, yes, you will only see what's relevant to your organisation, so and to your role. So the idea I mentioned earlier that if you're in an admin and clerical role, you are unlikely to be targeted with future nurse, future midwife courses. They will not be in your list of things you can do. But if you suddenly switch to admin and clerical to a medical role in a different organization, then the system will smart pick that up, and you will then have future nurse, future midwife available to you.
Could I just ask could I ask just a quick question on that? Will there then be opportunity, so with discussion with your manager, to maybe access other courses that maybe not be specifically targeted to you as part of a, professional development pathway that has come through the appraisal, or identifying that actually this will be helpful because you're moving into that field or you're aiming to go to that field?
Yes,
absolutely.
We can target individual users, but that would be an ad hoc, not self-aware sort of process, if that makes sense. You can target small groups down to organization units. You can target subdirectorates, you can target directorates, you can target organizations, you can target trusts. So we're trying to make it as smart as possible, that when you first sign on, it picks up you're in a medical or a finance or a training role, and you are presented with stuff you must do in an easy to find tile, and stuff that you can do in an easy to find tile that's only relevant to your role and or organization.
Yeah, Maria, the other thing we should probably add in the little tiles that the guys showed you, look, all of this is very much on how the content administrators actually target the training. So if someone doesn't actually set a group or a target, it'll go to everyone. So you do need to specify that. But when you go into the My Learning, if it's been targeted to your My Learning, it'll be there. Otherwise, there will be a full list that's available within your trust. And even a level above that, there's a little catalogue button that will actually pull the training from all the tiles into one list. And there's also search functionality, so that there's lots of ways to find training.
Folks, I am absolutely delighted that we've had such enthusiasm for the session today. I know there's a few questions that are still outstanding. I'd appreciate it if the team would maybe get those FAQs pulled together, and we'll obviously make those available. Lots of questions still coming through, and I have a few of my own that I'll send through to you, Yvonne. Next month's session is another Encompass session, and it actually links to this. It's about super user training, and the whole concept of pay it forward, pay it back with training. And I know this platform will be another hot topic for next month's session as well, I'm sure. Thank you all so much. I was delighted to see some of the things that are coming through. As an ex-trainer myself, I am delighted to see some of these changes that are coming through, and we will get back on the outstanding questions.
Okay, yeah, and please do, contact any of us if you'd like to have a wee chat.
Okay, thanks very much, everyone. Hope to see you all next month.